Ever find yourself puzzled by the jargon on your medication labels? Understanding these labels is more than a matter of decoding medical lingo. It's about ensuring safe and effective use of medications. Misunderstanding these labels could lead to serious risks, like overdose or ineffective treatment. It's crucial to know what you're taking, when, and how for your health's sake. That's why we're here to help you navigate this often confusing territory. So let's dive into the most common questions about medication labels. One of the most common phrases on medication labels is, "take as directed." But what exactly does it mean? Essentially, this phrase is a direction from your healthcare provider, instructing you on how to correctly use your medication. This could mean taking a specific number of pills at a certain time of day, or using a topical cream once every evening, for instance. It's crucial to adhere to these directions meticulously. The effectiveness of your medication relies heavily on how you take it. A deviation from these instructions can result in your medication not working as intended, or even lead to harmful side effects. Remember, take as directed means following your doctor's instructions to the letter. Another common term you might see on your medication label is PRN. But what does it mean? This abbreviation, PRN, is derived from the Latin term pro re nata, which translates to as needed. It's used in the medical world to indicate that a particular medication should be taken only when necessary, rather than following a regular scheduled dose. This could refer to medications used to alleviate sporadic or situational conditions, like headache tablets or allergy medication, for example. It's always crucial to understand these instructions to ensure you're using your medication safely and effectively. So, in a nutshell, PRN means you only take the medication when you need it, not on a regular schedule. You've probably noticed various warning labels on your medication bottles, but what do they all mean? Let's delve into some of the most common ones to help clear up any confusion. Firstly, do not operate heavy machinery. This warning is found on medications that can cause drowsiness or impair your reaction time. This includes certain pain relievers, sedatives, and even some types of antihistamines. The danger here is that operating heavy machinery or driving a vehicle under these conditions can lead to accidents. Next, do not consume alcohol. This warning is pretty straightforward. Some medications can interact with alcohol, causing adverse side effects or reducing the effectiveness of the drug. These can include medications for heart disease, liver conditions, and mental health disorders, among others. Then we have take with food. This label is usually on medications that can irritate the stomach lining or cause nausea if taken on an empty stomach. Eating a meal before taking these medications can help protect your stomach and reduce discomfort. Lastly, avoid sunlight. Some medications can increase your skin's sensitivity to sunlight, causing sunburns or rashes. This warning is common on certain antibiotics and acne medications. In these cases, it is best to use sunscreen, wear protective clothing, or avoid sun exposure altogether. Remember, these warnings are not suggestions, but essential instructions to ensure the medication works effectively without causing harm. Warning labels are there for your safety, so always make sure to read and follow them. Let's recap what we've learned about understanding medication labels. Firstly, we discovered the imperative nature of following instructions exactly as directed. It may appear to be a simple task, but it's much more than just reading words off a bottle. It's about understanding the precise dosage, the correct timing, and the potential interactions with other medications or food. It's about knowing how to store your medication appropriately, and what to do if you miss a dose. Next, we delved into the meaning of PRN on a medication label. This abbreviation, stemming from the Latin phrase pro re nata, translates to as needed. It's used when the medication doesn't have a fixed schedule and is taken based on symptoms. Remember, even though PRN gives you some flexibility, it doesn't mean you can take the medication whenever you want. It still requires a level of understanding and judgment, and if you're ever unsure, always consult with your healthcare provider. Lastly, we discussed the significance of warning labels. These are not just mere suggestions, but crucial pieces of information designed to protect you. They may indicate potential side effects, interactions, or precautions that you need to be aware of. Remember, understanding your medication labels is crucial for your health. If you're ever unsure, don't hesitate to ask your pharmacist or healthcare provider.